Welcome to this Case Med Minute video. Today we're going to be talking about meningitis. So this is the question that we're going to be reviewing. If you would like to pause the video now to go through the question on your own, you're welcome to. Otherwise, we're going to jump in and go through the question sentence by sentence together. So starting off with his first sentence, we have a 23-year-old man who presents with fever, headache, a petechial rash. He reports neck stiffness and photophobia. So right off the bat, I hope that you are thinking meningitis. So this patient has a lot of symptoms that are concerning. He has fever, the headache, petechial rash, and then he also has neck stiffness and photophobia. So a whole bunch of symptoms that all point to his meninges being inflamed because of some sort of infection causing all of these symptoms. Jumping into our next sentence, we have CSF analysis. So he got a lumbar puncture and it showed an increased opening pressure, neutrophilic pleocytosis, elevated protein, and decreased glucose. So let me just pull up this nice table from first aid to talk through kind of what all of these different things mean, because it's very high yield to be able to interpret these CSF findings. So first, the opening pressure is usually elevated in bacterial, fungal, and viral infections. So that doesn't really give us a whole lot of information. However, the cell type does. So um, in bacterial, you'll have a lot of PMNs, which makes sense, right? Because neutrophils often respond to bacterial infections versus fungal, TB, and viral, which will all have a lymphocytic pleocytosis. Pleocytosis just being elevated white blood cells in your CSF. So our patient has a neutrophilic pleocytosis, so we're already kind of thinking this is probably bacterial. Proteins are often elevated again in all three, so this doesn't really help us a whole lot. And then glucose is going to be low in bacterial or fungal, and then normal in viral. So here we have decreased glucose. This whole picture kind of fits with a bacterial meningitis. Someone once told me to remember this as like the bacteria are eating up all the sugar in the CSF. So we think this is a bacterial meningitis. And before we jump into the next sentence, I want to talk a little bit about common causes of meningitis. So I like the way that first aid splits this up here by age, so different pathogens and how common they are by age group. So in newborns, 0 to 6 months, there's GBS, E. coli, and Listeria. I'm going to kind of tie this to real clinical practice. You know, this is part of why women get screened for group B strep kind of in their third trimester of their pregnancy, and then maybe needing penicillin at delivery if they have a positive test. Um, so that would be, you know, to protect the baby from GBS. In children, you have a different set of pathogens, so strep pneumo, Neisseria starting to come into play. H flu, in particular, you think about patients that haven't been vaccinated yet, GBS again, and then enteroviruses. And then 6 to 60 years, so most kind of middle-aged patients, including our patient who's 23 years old, strep pneumo, Neisseria, enteroviruses, and HSV. And so Neisseria in particular, often you'll see a question stem with a younger patient, maybe lives in a dorm, maybe in the military, kind of close living quarters. And that makes you worry about Neisseria because it can spread in close contact. We have a 23-year-old, so I'm already thinking that Neisseria might be our answer. And then in 60 plus year olds, so older patients, you have a lot of similar pathogens to the children. The only difference here being instead of enteroviruses, you'll see Listeria popping up again. And then just to kind of read the notes at the bottom, ceftriaxone and vancomycin are your empiric treatment for meningitis. So ceftriaxone to cover strep pneumo and Neisseria, and then vancomycin covers some resistant strains of strep pneumo. And then you can add ampicillin if you are concerned about Listeria for any reason. Um, so let's go ahead and read the next sentence. So Gram stain of the CSF shows a gram-negative diplococci. So now we know what our answer is. It is in fact Neisseria meningitis, which is a gram-negative diplococci. Um, but that's not what the question is asking us. So the question is asking us, which of the following virulence factors is most important for the organism's ability to cause disease in this patient? So the first question is, which of these five answer choices is actually seen in Neisseria? So A, capsule. Neisseria does have a capsule. B, exotoxin A. No, that's not Neisseria. C, protein M. Again, not Neisseria. D, lipoteichoic acid. No. And then IgA protease is also seen in Neisseria. So I think it could be one of those two things. Well, let's run through the other answer choices to think about what pathogens have these virulence factors. So, exotoxin A is seen in Pseudomonas. It is um, a factor that inactivates EF2, which is normally involved in protein synthesis. Um, Protein M is something that is seen in strep pyogenes and it prevents phagocytosis. And then lipoteichoic acid is something that is on the outside of gram-positive cells, so definitely not seen here in our gram-negative diplococci. So then going back to A and E, let me pull up the section on bacterial virulence factors from first aid. So the capsular polysaccharide, this is something that acts as a barrier to phagocytosis and complement-mediated lysis, and it is a major determinant of virulence. And then IgA protease, this is an enzyme that cleaves IgA, and it allows bacteria to adhere to and colonize mucous membranes. So if you remember, IgA is the main immunoglobulin that's involved in the kind of mucous membranes of the body. So that's why IgA protease is helpful in this case. So I think given that, I would go with A as kind of, like they said, the major virulence factor. And indeed, that is correct. All right. So I think the key takeaways from this question is it's really high yield to know the different findings, CSF findings for different types of meningitis. And then, as always, knowing these kind of virulence factors that you learn in Sketchy for different pathogens. Hope this was helpful.